From the furthest reaches of the earth, it seems, have I come to visit you, recluse in Tinbourg. Welcome, Dr. Howitfogate. Thank you. As the chief medical advisor to the King and Queen of my country, and overseer of all medical and public health matters related to it, I need to be constantly maintaining myself in the very best of health. Of late, though, I am sick to death almost with worry, my brow continuously being populated by myriads of sweat drops. My skin keeps turning pale shades of greenish grey throughout the day. Because of it, I cannot even walk in a straight line anymore. My blood at times feels as if it is all about to clot up. My speech, as you can hear, is somewhat slurred and tends towards being out of proper sequence, even missing out it is, here and there, on the proper pronunciation of vocabulary most familiar to me. When I arise from my bed in the way early dawning, I feel as if I haven't slept a wink throughout the night. All day long my eyes are not clearly seeing at all. When it comes to the end of the day, which more often than not will circle the midnight hour, and I take to my bed to rest and to sleep, I feel as if I have not yet got out of bed because of all the worrying I had been doing in the morning, in the afternoon, and right on all over into the eve. All of me within is in a very, very mixed up and turbulent state. What can I do? What should I do? Before you can hope to do anything about it, you need to know what exactly it is that is giving you such uneasiness, giving you such dreadful discomfort and anxiety. Oh, that is not the issue, for I know well what it is that is giving me such dreadful discomfort and anxiety. What is it then, may I inquire? Well, plainly stated, I am very afraid for you. I am really worried for you. For me? Oh, why so for me? Why not you for your king and queen and your fellow subjects? I am of course by natural disposition and duty worrying for them, but I am afraid, so very afraid I am that if you, although thankfully now is in, it seems, the very best of health, don't have yourself immediately inoculated against the highly contagious, dangerous disease that is presently sweeping the island, and not alone sweeping the island, but the entire world, save of course for a few remote, isolated places, that you will long ever before your time be of the no longer long with us. So it is for that I have come myself to beg you in person and on behalf of His and Her Majesties to take the golden and silver inoculations. The world needs your continuous presence, needs your knowledge, your wisdom, and above all, your joyful hopefulness. It can't afford to lose you to this awful viral pandemic which is showing no mercy whatsoever, for without making any a distinction between the wise and the foolish, the rich and the poor, the elderly and the young, does it haughtily swat them low and right out of existence, as would a bolt of lightning consume any a tree of the valley, hill or forest thick, save perhaps for that of the majestic lone oak. I myself have, in the last as many months, already received, as has my king and queen and over 97% of my fellow subjects, 5 golden injections and 2 silver boosters. Did you or have you experienced or noticed any immediate or potentially long-term side effects from them? After the first golden injection, I experienced some slight anemia and an increased tendency to bruise, lymphadenopathy, thrombocytopenia, cardiac palpitations, angina pectoris, myocardial infarction, cardiac flutter, tachycardia, atrial fibrillation, and that was about it really, nothing more. After the second Golden, I experienced some slight ear pain, hypoacusis, tinnitus and vertigo, hyperthyroidism, Vertigo floaters, conjunctival haemorrhage, Blepharospasm, dry eyes, swelling of eyes, eye pain, eye pruritus, photophobia, diplopia, vision blurred, visual impaired, colitis ulcerative, toothache. And that was about it really, nothing more. After the first booster, I experienced some slight diarrhea, dyspepsia, abdominal pain, gastrointestinal pain, constipation, nausea, vomiting, dry mouth, and that was about it really, nothing more. After the third Golden, I experienced some slight hypoesthesia aura, paraesthesia aura, lip swelling, mouth ulceration, glossodynia, swollen tongue, asthenia, fatigue, malaise, hyperpyrexia, chills, feeling abnormal, feeling cold, feeling hot, and that was about it really, nothing more. After the fourth Golden, I experienced some slight temperature intolerance, gait disturbance, injection site erythema, injection site pain, injection site swelling, chest pain, hypersensitivity, anaphylactic reaction, cellulitis, nasopharyngitis, sweating fever, blood glucose increased, hormone level abnormal, heart rate increased, blood pressure increased, and that was about it really, nothing more. After the second booster, I experienced some slight decreased appetite, dehydration, bone pain, pain in jaw, arthralgia, joint swelling, myalgia, muscle fatigue, muscle spasms, musculoskeletal stiffness, back pain, limb discomfort, neck pain, pain in extremity, groin pain, and that was about it really, nothing more. And after the fifth Golden, which I had only 3 weeks ago, I experienced some slight lethargy, somnolence, syncope, facial paralysis, cluster headache, hypersomnia, dizziness, pre-syncope, burning sensation, hypoesthesia, paraesthesia, seizure, dysgeusia, taste disorder, tremors, anxiety, nervousness, depression, insomnia, irritability, panic attacks, dyspnoea, cough, pulmonary pain, dry throat, rhinorrhea, sneezing, skin discoloration, eczema, rash all over or in parts, deep vein thrombosis, and that was about it really, nothing more. And it behoves me to mention to you too that in all this time, the sun in the grove hasn't risen even once, if you get my drift. Not since before the taking of the first Golden has it ever again since arisen. That is terrible. It is, and not alone that, the fertility too is probably somewhat endangered for the some time being. That is beyond terrible. It is all right, I suppose, when you think about it, but it can't be helped. You can't have everything. Something has to be given up for the greater cause. And tell me, before you took the first Golden, how had your health been up till then? How was your immune system? Well, perfect well it was. I was in the very best of health, so I was. My immune system was successfully fighting off everything and anything that came its way. It was for that very reason that I took the first golden. I wished to protect my perfect health by means of giving a super boost to my T cells. I see. Then these golden and silver inoculations, how many years of vigorous clinical trials had they gone through before they were finally fully approved and made available to the public? No, not yet years, more like of months, and they are at that only partially and tentatively approved on a week-to-week basis at present. Are you serious? Yes, I am. Deadly serious I am. Then how long do you anticipate this disease will exist for before eventually fading away and being no more? I have no such an anticipation. Rather, I believe it is here to stay forever and ever a day by virtue of its aggressive mutations and our inadequacy to totally eliminate it. That is not the main thing, though. The main thing, though, however, is that the ongoing giving to the body of golden and silver inoculations will at least introduce some bit of frustration to the disease, confuse it will somewhat, and thus, as they say, it won't ever be able to make a full secure foothold. If you don't mind me asking, but what age are you? Oh, no problem at all. Come this December, I will be 29. But enough about me. Rather, I truly hope, I truly wish, and truly pray that you will consider getting inoculated as soon as quick possible. That is the primary reason why I have come here from afar to see you, to try and convince you that though you are, it seems and sounds, now in the very best of health, you need at the same time to protect yourself from this no mercy, non-differentiating disease. Perhaps you are dreadful of taking the goldens and silvers, but I would assure you there is no need to be, for save from experiencing some slight discomforts akin perhaps unto those of mine mentioned afore, you will overall be as me, feeling the very best to near find most of the good time. Well, isn't that good to know now? Good, of course it is, to be in the well-known. My focus is on the health of all my times versus the health of my given moments. My long-term future versus my immediate future. The latter focus would have me turn a blind eye to the importance of the former, deeming it to be not really important at all, at least for the forever time beings. The issue here is the fullness of real health versus the emptiness of false health. And besides, I have no fear or no problem whatsoever taking fully trialed, minimum say 10 years vaccines for various conditions, should I ever have any such conditions. But as a conscientious subject, I cannot ask my body to take a substance that is only winging it, masquerading itself as a vaccine. And of all things, I don't wish to be treated as a test case for opportunistic pharmaceutical companies. I ask myself, would a trainer of champion racehorses chance giving an unknown substance to them? What is being peddled out there around the world is nothing short of a crime against humanity, where national and international codes of ethics are being cast wholesale to oblivion. I refuse, yes, I refuse absolutely to let myself be coerced by such a nefarious action. Hoc est enim corpus meum. This is my body. Mine it is to take the very best care of, not alone for myself, but for my beloved and our precious lovelies, extending for the way to way on ever-reaching generations. I need to make sure that they can proudly, with ever happy remembrances of me be, and that this too they can do based upon sound knowledge, deep wisdom, and unhesitating courage should ever, as similar to same circumstance, all of a sudden upon their pathways appear, seemingly it having come from out of an unknown somewhere. Do you take the same branded goldens and silvers each time? No, to be on the safe side, I take a cocktail of those produced by the 8 leading global pharmaceutical companies. And although they are all very broadly the same to a varying degree and percentage of efficacy, they are all different too, especially from the point of view of how each came to be, what mechanisms were employed in their development and type, for instance, as protein subunit, conjugate, inactivated, recombinant, peptide, non-replicating viral vector, adenovirus, or mRNA-based. Yes, but what about the years of clinical trials necessary before an inoculation is deemed safe to use? Given the sheer magnitude and urgency of the situation, there is no need to be over-concerned about that little detail for the moment. That is more than just that little detail, surely, when it comes to the authorization process. Emergency use authorization is enough for the continuous time being. Honestly, how can such an essential requirement be cast aside? It has anyway, and that is the way it is to be for the foreseeable time being future. That is running along at a breathtakingly unstoppable speed. What do you take to have been the source of this disease? Whence did it originate? That now is indeed an extremely touchy subject, I must admit, for no one at all is really sure, and if there are some who do, they are not saying anything or giving anything away, nor is it known for certain how long it intends to stay, or where to, if at all, it is headed, or if it will ever again make a return visit, not just once, but perhaps numerous times. And besides this to that is not really important. Really? What then is really important? Learning to live with it as healthily and responsibly as the goldens and the silvers will permit us to, while all the while we put our full trust in reputable global pharmaceutical companies and their affiliates to come up with an once and for all way to totally eradicate it, or at least to stop dead the transmission of it in its tracks. And in partnership with this, to have leaders, governments, and local officials all fully adhere to the advice of their chief medical officer. Now, having heard all from me clearly on what is crucially at stake, heard all from me on what is giving me my greatest uneasiness, giving me my dreadful discomfort and anxiety, will you not, I implore you, please now come into line with the great majority here on the island and around the world and get yourself at the earliest possible time vaccinated. I am so very afraid for you. I am really worried for you that although thankfully you are in the very best of health that I can see and know from you, that if you don't have yourself immediately inoculated against this highly contagious, dangerous disease, you will long ever before your time be of the no longer with us. I thusly do beg you to take the golden injections and silver boosters, for the world needs your continuous presence, needs your knowledge, your wisdom, and above all, your joyful hopefulness. It can't afford to lose you to this awful viral pandemic, which, as I have already said, is showing no mercy whatsoever. But without making any distinction between the wise and the foolish, the rich and the poor, the elderly and the young, does it swat them low as would a bolt of lightning consume any a tree, save perhaps that of the majestic lone oak. Thank you, Dr. Forget, for your great concern for my well-being. Truly I appreciate it, but I will request of you to have the courage to let this oak tree be in the fine company of its own strength and courage. Let it be in the courage and strength of its companion oaks to weather out this storm. As two great oaks are my beloved and me, standing side by side in such trust and bravery. Worry then not on any further over me, over we, but over yourself and your beloved ones and the world be. Oh, my mind truly, I know to be a wondrous place, its ideas and their ways immensely fascinating.